Welcome to the Sultans of Sales Podcast. I'm your host, Jamil Pendleton. My friends call me Jay. Today on the show, we have the fabulous Chet Donnally, who is a rising star in the field of spine surgery. He's based out of Dallas, Texas. He's got such an awesome just story, and from where he went to school, such as he went to University of Miami for his residency. He went to the Rothman Institute, learning from titans of our industry, such as Alan Hildebrand, Alex Vaccaro. But honestly, I think where the magic started, Dr. Donnally, and you correct me if I'm wrong, is where you went to undergrad, which is the pinnacle, right? The Harvard of the South, SMU, Southern Methodist University.
That's right.
And we share that.
Exactly. That's right. Yeah. I loved SMU. You know, it was right in my backyard. I grew up here in Dallas. And so kind of growing up, I never thought I'd stay in the same town going to college. But I do think my parents did a lot of inception. And now that I have a little kid of my own, I don't want him to even go to any school ever. I don't want him to leave the house. So I get it. I'm sure my parents were thrilled when I told them I was going to SMU. They kept it close to the vest, of course. But
sure.
Yeah, I was SMU for undergrad, and then started traveling all across America after that for medical training.
But you came back, right?
But I came back, of course.
You know, and again, thank you so much for carving out some time. Like, I'm just fascinated when I see some of the things that you're posting on social media. And I know that we've connected there and we've talked offline, you know, quite a bit about that. But first and foremost, just for the audience to kind of get to know you a little bit better, what made you want to become a surgeon? Where did that start?
Well, kind of a little in high school. I kind of jokingly say that I was going to play football in high school, but then there's a guy named Matthew Stafford who's a little better than me, so I didn't do that. I thought about doing baseball, but a guy named Clayton Kershaw was a little better at baseball, so I started I'd be like a social media star. And then Amber Vins, known as Amber Box now, created a reward style billion-dollar company there, so it kind of outshined me there. So I decided to do medicine as a backup instead, and that's kind of where I am at now. And then, like most people, I guess if you're in medicine, you usually had either a parent or a family member in medicine. You were sick for a long period of time, so you're surrounded by doctors, or you had like a very stereotypical sports injury, and that was kind of your exposure. Fortunately, mine was the latter of those. It was my senior year in the state championship playing hockey. I had like a really bad injury, had to go see doctors, had to get surgery for it. And then I thought the doctor treating me at the time was the second coming of Jesus. Many people know him. He's Butch Krishnan. He's a very famous shoulder surgeon here in Dallas who, you know, he's the man. Everything about him just kind of like, I thought it was the greatest. I thought he was the coolest thing ever. And that's kind of what shifted me from wanting to do what I thought I was going to do to go into spine surgery. Initially, I thought I was going to go into the military for, you know, better or worse. I had toured Virginia Military Institution with my dad. I was working with Pete Sessions to get my letter for West Point. I was kind of do like a service industry, like a respected industry, something like that. And then when I had my injury and got surrounded by doctors, I was like, oh, this seems like, you know, not as hard of a path as a military path, actually. And kind of wound up here.
That's awesome. And that is kind of where the spark was lit, right? And you saw how he treated you, and that's so neat to hear the origin. And so now, I mean, you've got such a, I love what you do on social. Again, that's where we connected, right? Through LinkedIn, and it's been great to get to know you and come to know, we know a lot of the same people.
Yeah, exactly.
It's a small world. What about, so talk about a little bit about your practice today and kind of what you're focusing on.
So most of the practice I'm doing is there's a little trauma. Most of it is elective spine surgery. That's anything from the skull down to the pelvis. And I do a lot of deformity work because it's not as sexy or a desired thing to do. So a lot of deformity, but then kind of my niche and my training and kind of most people's training coming out these days is all the quote unquote minimally invasive. We jokingly say that doesn't mean that the guy across the street's incision this big and yours is this big. It's more like the pre-op medications you give, the epidural blocks you give to identify which nerve roots it is, kind of keeping the incision small because you know exactly which nerve it is. And instead of doing a huge fusion surgery, maybe just a one-level laminectomy or discectomy or something small, kind of in and out. And that's kind of where we're heading towards right now.
Yeah, no, and I mean, that's just the minimum necessary, right? To treat the pathology for each patient. And that's just what's so been fun for me, you know, through the years to work with surgeons like yourself, who it's every single patient is a new challenge, a new, you know, puzzle to solve and to lean on your training. So let's talk about the future the near future, right? We're coming up on the end of a tumultuous year, I would say, 2021, and kind of getting back post-pandemic. And so in 22, where do you see spine surgery going? Or maybe a better question, what are some of the challenges you see faced that you're going to face in surgery? Maybe some annoyances, right? Let's dig in.
Sure.
Let's talk about that.
Okay, so like annoyances. Again, early in practice, but I hate using cliche expressions in terms of like who the bad guys are or what the annoyance are. But like I definitely see, if you get really bored, how about this? If you get really bored, go Google physician versus hospital administrator and then hit images, and you'll see hundreds of charts that just show there's been a tiny increase in total physicians in America, and there's been an astronomical, huge increase in hospital administrators, and they're great. Everyone I've ever worked with, to be fair, has been fantastic. But to be fair, every hospital administrator I've worked with, like their job is physician relations or making things good for the physician so you come to their hospital. But all that extra red tape, all those extra employees, all those extra salaries and bonuses, that money's not coming from nowhere. That's coming from something. That's coming from the patients. That's coming from the insurance companies. And that's just another contributor what's driving all the cost up in healthcare. And so the health companies respond by, one, trying to make surgeries less frequent, and that's by denials. And I know that's a cliche thing to say. And then two, kind of squeezing the money out of the doctor. It's not like the doctor's taking home the paycheck. He takes home that check and has to give it to his office staff and keep the lights on at his office and runs a small business there. So kind of the rise in overall administration, red tape is just kind of limiting for doctors. And so frequently, maybe every 3 weeks, I'm doing a quote unquote peer-to-peer with an insurance company. And, you're talking to them and they will tell you right up front kind of what their background is. And, frequently it's someone who's a pediatrics or family medicine, which is great, super important fields. But in terms of speaking with my peers, it's hard for me to describe exactly why someone needs an indirect decompression for foraminal stenosis. It's just, I use like 4 words that they've never had to know.
Right.
And if you try to quote literature, one of the problems coming into 2022 is, a lot of these big journals that are all respected, but there's all so many small journals out there that found a way to make a profit from having APCs. Pretty much you pay and you get your publication in, and you make these journals profitable. Well, the problem with that is also now you get like the Ecuadorian Journal of Hip and Knee Medicine, like 2nd edition, part B. Yeah. And all you got to do is publish something in there saying, oh, fusion's a bad thing to do. And then that peer-to-peer is going to cite this crazy journal.
Right. It'll
you can prove anything. I can find an article out there to prove to you that water is not wet. There's a study out there to prove everything and prove against everything. So that's kind of an issue we have coming up, is just fighting with insurance companies, fighting with hospital administration, kind of take care of these patients.
And it's interesting too, because you're well-spoken and well-published. One of the things that when I was researching, kind of getting ready for this, you've got over 70 peer-reviewed publications in the journals that actually do matter, right? In spine, in Journal Neurosurgery, right? The Spine Journal. So those are things that I would say advance surgery and advance medicine, right? For your peers. And so you have every bit of a right, I would say, to speak out about what's really going on, the rise of administration and kind of the bureaucracy around medicine. It's fascinating. So, okay. Your presence on social is awesome. I mean, earlier today I saw, something that you put together with some awesome, house music and kind of showing reduction. I mean, for me, I geek out on this stuff because I've been in these ORs with surgeons like yourself, and it's that high five, awesome moment when you're able to accomplish your goals in surgery. But to see it, just kind of the time lapse way in which you did it, and just kind of how you're telling a story, right? I resonate with that because in a much different way, that's what I'm trying to do. It's just awesome. You're present. So why do you do that? And where do you see this going? Like, what are certain platforms you're focused on? I'm just kind of, let's talk about social media for you.
Okay. So again, of course we can talk about this for hours. Yes. Kind of the key thing to focus on is like, what's your goal? Like, are you just throwing water into the wind? It makes no sense. Like, what are you trying to do? So for me, when I initially did it, I was just putting stuff up because I thought it was fun. I was doing memes just because they were funny.
Right.
People didn't even know it was me doing it. It's kind of a fake name. I was doing it maybe once every like 6 months or something like that. Then I started doing actual really good spine surgery. People actually got pretty interested in it. And then you start putting up educational content, people get interested in it. The thing that's kind of, snowballed into now, it's been pretty exciting, is it's incredible. I can either put up a meme of something about anesthesia delaying you, and I get people in Egypt, Chile, Dubai that are all like, oh, this is exactly what happens to us. And it's just so crazy how different and similar we are in the same fields. Same thing with, I put up publications all the time. And just like how you could go to a conference once a year, you could fly somewhere, spend a whole weekend there, learn about a couple different new studies coming out, or pay $1,200 for a journal that comes every 3 months and kind of flip through there and read the new studies. Okay, that's great. Not downplaying those, but one thing that kind of COVID normalized a little more is the use of telemedicine, the use of Zoom, the use of social media for an educational purpose. Instead of going to these conferences, you could kind of Zoom into them now. Mm-hmm. Kind of same concept with sharing publications via social media. Social media is not just for kids anymore. I could put up a journal article and we can kind of debate it. We can say why that's a garbage article, or why, oh, I actually think that's a really good fusion technique. Let's do that. And you get people from all over the world kind of debating it. You don't have to have someone walking up to a podium in front of maybe 40 of their peers and they'll be nervous asking a question. You can just comment on it, debate it. You can learn. It's kind of like what a great time to be alive, where the author of one of those publications might be in that comment section. It could answer those questions for you. Like, what other time do you get a forum to talk to someone like the biggest titans in spine surgery on a daily basis? And that's the other thing, CSRS, NASC, great things, but only once a year, as they should be. They should be more, don't get me wrong. But, that's a big time commitment to go to those. Mm-hmm. Why not have where you on LinkedIn, Instagram, kind of wherever you're spending your social media time, you can go to those and have like a little mini journal club. So it's a huge educational component too. The other thing is kind of just share complex cases. Like there's things, the way I do it is I kind of put up all my pre-op images and have people debate. And it's really crazy off the wall things. And a lot of people say things like, yeah, I didn't really think about that. And usually, almost always, actually, I've already done the case. So it's not like I'm asking for advice necessarily. Not that that'd be 100% wrong, but I'm not really asking for advice. I'm like, oh man, maybe I should have thought of that. And then I show what I did. And I was like, well, that was actually a good idea. Mm-hmm. Next time I'll consider that, or, I'll ask my other peers about option B and C that I never even thought about. So there's a huge educational component to it. And I really hear that from a lot of my peers. And, it's not just here in America. It's, there's so many people I've been connecting with in South America, Middle East, India, huge in South Korea, really big social media presence there. And they just love talking about this stuff.
It's awesome. I've noticed that too. I mean, and it's for me, it's such an opportunity to continue to be educated on the latest techniques, because, when I was a sales rep living the life, there was a once a month conference every Tuesday morning with grand rounds. And I was able to be just kind of a fly on the wall around the surgeons doing exactly what you're doing online. Right. But it was, again, it was in person and not exactly as scalable as what you're doing and your peers are doing. And it's fantastic. And so please keep it up. It's great for us to learn.
Exactly.
Are there any just wanted to touch on the platforms, because like I've gone really kind of doubling down on LinkedIn, but there's Twitter, right? There's Insta. I mean, what are your thoughts on that?
So none are wrong. You just got to know your audience. I say it's like, each app's for something. If you were trying to, if you're trying to find a relationship and you want to find someone that's going to the clubs and partying, you're not going to go to farmersonly.com, right? You got to know like where your target audience is to get what you want. So broadly speaking, I'm a spine surgeon. So most of my patients, I have some that are, 30s, 40s, like disc herniations, but the majority, kind of the meat of spine surgeons is patients that are much older, like in their 60s, 70s, sometimes 80s. These aren't patients that are on TikTok or not necessarily Instagram. So when I'm using it, I'm not actually ever even trying to market to patients. That's not my goal. Those that market to patients should be, plastics and derm as a very, very broad generalization. Mm-hmm. Those are more, elective kind of cash procedures sometimes. And that's when you're trying to really market to your patients. I'm really marketing and educating my referral patterns, kind of pain docs in the area. Everyone, whether they want to admit or not, has some form of social media. So I kind of just target them all, whether it's LinkedIn, Facebook, TikTok, and Instagram. If you do something on one, it's easy to do on all of them. Mm-hmm. So you just got to know your audience. I always thought one of my buddies, Matt Hard, he's a pretty well-known joint surgeon kind of in the Baltimore area. He kept telling me forever to get on TikTok. And I was like, man, dude, like, I'm not trying to talk to like 14 and 15-year-olds. Like, what are you talking about? He's like, you're missing the point. He's like, content is king. That's what I say. It doesn't matter what you're doing. Just keep doing it. He's like, you can generate easy videos very fast, and then you can put that onto your other platforms or put that onto your YouTube. And that's where it is. Like, and you kind of you check the box of TikTok. And I've actually been really shocked. Again, I never thought in my life, and I'm embarrassed to say I'm even on it, I never thought in my life I'd be using that type of media platform, but he's right. It's been more interactive than most of the others, and it generates content that I just save and then put on my other platforms
100%.
As well. And again, content is king. He was completely right.
TikTok is great. I mean, one of my fraternity brothers, you may know, he's a little bit older than me, Brad Bader. He's a plastic surgeon in Dallas, and he does a fantastic job on TikTok.
And that's, that's the field. He doesn't need to be targeting LinkedIn or something like that. I think LinkedIn's purpose more so is for getting with other doctors and industry. That's where the key is with LinkedIn. And I agree with you. I think doubling down on that was good. I remember talking to one of the execs at Nuvasive, and I was kind of showing him this stuff. And I remember telling me, he's like, if I had $100 and I could bet I could split it on all these platforms, I'd put 200 on LinkedIn. I was like, okay, this guy knows what he's talking about. So I think that's an important way also, just in terms of promoting your brand. It's not like I have the Alex Vaquero research machine or the Parvizi research machine behind me that's going to make publications that gives me podium talks, but I don't need that anymore. I have a free app of something I like to do when I'm waiting for cases to go. I can work on it in between cases. I can work on it. When I'm watching a ridiculous show with my wife on TV, at night I can work on it.
Yes.
And I can post it. It's like having my own podium presentation every couple of days that I get out to, sometimes, I can tell the numbers. Sometimes only 4,000 people are seeing it. Sometimes 50,000. I've had a couple of videos that's 500,000 people are looking at it, and sharing it. That's just a way to kind of promote your own brand. And it's incredible.
I love it. It's so just awesome to hear. I mean, that you completely get, this world that I know to be the future of at least sales and marketing, because you mentioned something earlier about COVID changing it. I think it's kind of sped up some things, right? We've talked about this. So It's sped up the move to ASCs. It's sped up the way in which we have to communicate, or just normalized it a little bit, because look, you're in Dallas, I'm in Austin, right? We know a lot of the same people. Like it would probably be easy for us to get together, but you got the holidays, you're a super busy guy with families or all these things. How easy is it? I mean, we had to schedule this, but just to get together, to come together and have this conversation. And then hopefully people get something out of it, and we share it and we scale it. It's awesome. So speaking of podiums though, you've actually given this talk, right? With Dr. Lehman and at Columbia was it residents and fellows?
Yeah, and Dr. Lehman, he gets it. He's one of the, if you're a titan of spine surgery and you're already crushing it, and, if you're in your 50s, 60s as a broad generalization, like, you don't need to theoretically waste your time with this. You're already doing great. Like, why do you care? Why would you want to make extra work? You don't need to promote yourself. You're already doing good. Dr. Lehman's an outlier. He's a pretty young guy, to be fair. He's an outlier. He gets it. He's putting his stuff out there. He's promoting it too. But he kind of invited me to talk to the residents and fellows in terms of, one of the facets of what we're talking about is social media, kind of what advice do you give? And, I hate cliche expressions. And so for me to say, be careful what you post is just ridiculous. It's like, well, that was no advice at all. Like, that doesn't help me. So I give specifics on things. Here's what I say. Don't post any x-rays. It's just, even if there's no patient identification in it, you're not going to necessarily get in trouble for any of that, but your attendings are going to see it, or seeing around your attendings, and they're just not going to be comfortable or happy with you. That's going to hurt your letters of rec. They're just not going to fully trust you.
Right.
It's just not worth it. So if you're like, okay, well then what do I post? Okay, I do this. If you see an O-arm machine, how about you just record the O-arm and just give a little educate, like, here's what an O-arm is. It's a 3D C-arm in the room. Fluoroscopy. You can have a drill, show a drill, OR tools. You don't have to be crushing it while you're in residency and fellowship. You can give an education, like, here's what the 5 years are. Here's what we rotate through. Here's a general day of the life of a sports surgeon. There's so many things you can do without showing patient information. That's kind of what you should do those first 6-7 years while you're in training, because those aren't your patients. Even if you get them to sign things, just don't even mess with that stuff. Show things that aren't actual patients in those first years of your training. In doing that, they're essentially practicing a very unique but growing marketable skill for when they. Now you're exactly, because the other argument is like, well, just wait till you get out. It's like, man, that's like saying I'm just not going to do minimally invasive surgery for a couple of years until I feel like I have the right equipment to do it or something like that. It's like, man, you still got to be practicing it and still got to be working on it. That's how, when people are like, how long does this take you to do? It's like, honestly, a little while at first, but I'd learn like a new app to help speed me up, or like a new trick, or I just kind of copy and paste the same things to another post. And it's so fast now for me to do. And yeah, at first it is daunting. It is tough to do, but now like I can do like a really good post in, not too long.
Yeah. I love it. I've seen your work. I love it. And I feel like it's not it's not easy. It's not effortless. It does take some, the consistency is difficult, but I think once the content starts flowing, it's flowing, and then you get into that groove. I've certainly experienced that as well in a little bit. Okay. So here, let's talk about heroes. This was one of those questions I sent you in advance. So it's like everyone has a hero, right? Who's yours? Why? And then kind of like a secondary topic. Let's talk legacies, right? Because you're early in your career, and what you do now is going to be felt later, right? So let's just have a discussion around that, if you don't mind.
Okay, Jay, when I go to bed at night, I light 4 candles and say a prayer to 4 people who are my heroes. So I got Chris Kepler, who's in Philly at Rothman. And like, man, he's what makes, after Dr. Kevin, he was what makes that program go. He gives up so much of his time to let kind of the residents and fellows struggle through cases. He could knock them out in half the time and get back to his family, but he spends so much time with us, teaching us, and he's our friend first. Like, he's our boss, if he is, or colleague, however you want to say that, way second. He'd much rather go to a football game with us or hang out with us and talk about spine the whole time, as opposed to kind of be something else. So Dr. Kepler is someone that like I emulate. I would love to have any of his attributes he has. He's good surgically. He's a good friend. Dr. Schroeder's right there with him. He's also a huge rising star in the field, kind of rising the ranks in CSRS. Dr. Schroeder's someone else, the Greg Schroeder, who's, could get home much earlier to his huge house in Philadelphia, but instead kind of sacrificed a lot of time there. Of course, Dr. Vaccaro, another one of my life heroes. I had he just taught me how to talk to patients, both like in the office and then post-op on rounding. Just gave me so many fun tidbits to say. I had this med student who spent a summer with me and then went up to Philly because that's where he's going to medical school. And he said he finally met Dr. Vaccaro a couple months ago. And he's like, man, dude, he's like, you sound exactly like Dr. Vaccaro. And I told him, I was like, that is the highest compliment I can ever have. He's like, when you go in rooms, like, hey, like, hi, I'm a darling. How are you? How's my favorite patient of all time doing? It's like, I had been thinking about you all day to see if you were getting better. Are you getting better? It's like, oh, that just makes me so happy. Just things like that. Patients love to hear, be like, oh, I love those shoes. Those are gorgeous shoes. Who got those for you? Things like that, just charming patients. And then, of course, I lit the biggest candle, the biggest prayer from Mike Wing down at Miami. Nice. He is my all-time king. I tell him that like every like 4 or 5 months, I'm text, just thinking for kind of putting me on to spine surgery in general, to minimally invasive surgery. He can do no wrong. If he told me to chop off my left foot, I'd be a better spine surgeon. I'd chop off both my feet. I would do whatever he says. He's just, he does no wrong in my eyes. That's
awesome. I mean, what about Rushmore, right? I mean, right there.
Yeah, exactly. And so those guys kind of taught me the whole, like, what's your legacy? Kind of what's your goal? I've gone through all major companies. They always have like their 3 tenets or the 3 pillars or the 3 pillars of success. That's kind of the thing. Mine have been pretty easy. I always thought I want to be, a leader within my community, and you got to define community. So for me, kind of Dallas, I'm a native Dallas. So is my wife. We both went to, elementary school through college here. We both went to SMU. Wow. And then we left for, that decade to go get our training. So Dallas is my home. It's my parents, grandparents. So in terms of like being a leader here, to me, that involves, giving your time to kind of do things. My dad was really involved with me in scouts, like doing scout things. You get to kind of meet your community through that way, like being a good person that way, being a good role model to your kids, whether guys or girls. Just that's how my dad was to me. I'm probably, that's hopefully the only cliche thing I'll say is being a good role model to your kids, being a good husband, good best friend to your wife, and then being a leader within your field of practice. And that's spine surgery. So those kind of 3 things in spine surgery. I'm not going to be giving too many in any near future podium presentations at NASS maybe, but I can be influencing or getting in front of 40,000 eyeballs any single time I post. I can show that with a screenshot of any of my advanced stats. That's a big number. You go to NASS and maybe, 200 people are in the audience, 400 people are in the audience. I got 40,000. So having that in terms of kind of influencing for the better, kind of just disseminating research information and just talking about case conferences and case presentations. That's how I determined to be a leader within the spine community.
That's fascinating. It seems like with all of the things, a lot of the things that we've talked about and touched on today, and where the industry's headed, right? Whether it's just the macro, like the COVID stuff. I mean, it feels like that NASS and these types of large industry events, I don't think they're going to go away. I think they're going to shift. I think that there's an opportunity to do something completely different, virtual, maybe even. I mean, people like to stay in their lane and in their niche.
Yeah.
That's certainly, I think, would you agree from surgeons? Do you?
Sure. I think you should stay in your lane. It's
Yeah.
like, you don't want someone speaking other ways. I don't know how NAS and, those things will change. To be fair, I've probably been to 7 or 8 of them collectively. So I'm definitely no expert on those conferences.
Right.
But, the role of industry for sure, and their involvement with it should change. That's one of the big things. The more bureaucracy, the more red tape we have, industry's a 4-letter word to all of them. They think that, they don't know that, all of y'all have wives and families and kids and employees also. And, it's not like people are going to be doing things for free. It's not like you're going to be,
right.
Sacrificing your weekends or, I'm guessing, honestly, I don't know this. You probably took in this month alone, maybe 4 or 5 flights around just trying to promote new minimally invasive products. And
yes,
you should be compensated for that time. You're trying to make things better. It's not like you're making some bogus idea. You're trying to make things to help residency education, to help things be more invasive, or less invasive, to help the patient have a better outcome. And those are things that aren't free. That's why we lead the world in our innovation. Probably us, Israel, and some things coming out of South Korea. And that's why. It's because we have the funds to push that forward. And that's why things cost money. And research costs money. And that's just part of it.
Amen. Well, thank you for that. And certainly, I would just say, like, it's been really interesting to change from a large institution and just kind of into a much smaller startup environment and just see kind of the differences there. It's certainly exposing a lot, and it's good. It's a good learning experience for me. So let's shift to a little bit more. I just want to learn a little bit more about you. Like, what do you love about the OR? And I've heard, and I can't wait to be a part of this, about some dance music that is often played in your OR. So I love house music too. So there you go.
Yeah.
What do you love? Let's talk about your OR, Dr. Donnally.
So it's on Spotify. It's Spine Music Festival 1 or Spine Music Festival 2 is the newest version. Kind of a play on Ultra Music Festival, kind of tapping into my Miami days. But yeah, we do have that on, not too loud because honestly, I get sick of it after a while.
Right.
If it's a 3-level 360 after a while, I'm like, all right, let's change it to something else. Like, I'm over this music myself. But, OR is great. It's great when you finally get there, finally get to the finish line. And, I tell my buddies all the time, it's so hard to get patients to the finish line just from once they say, yes, I want surgery, and like those 3 to 4 to sometimes 5 weeks to get it there, like, man, it's a struggle. Sometimes they just can't get their clearance in time. Insurance companies won't look at it in time, or they say, oh, we need a note from PT saying they can't go to PT. And then you get to the day of, and maybe either like a vendor forgets something or you have an anesthesia issue. So just kind of getting them to finally make that decision, like, man, there's so much work that goes into it,
right,
of course. And then in the OR, like, things I like is, right when you go, like those first kind of 5 to 10 minutes, everyone knows their role. You're flying, the case isn't, boring or monotonous yet. You're doing the dissection, getting down under, you're identifying your levels. You really got to be, using your brain there. I say, Mike Wang would say he could teach a monkey how to do spine surgery. So spine surgery is easy. And it's long and challenging, but he's not wrong. The hard part is kind of knowing the anatomy, protecting the tissues while you're going in there, but like also having the efficiency while you're doing it. The repetitive task of like the decompression or putting in a screw, he's right. A monkey could do it. If you teach a monkey to do anything, is what he always said. It's kind of the diagnosis, getting them there, knowing which procedure is right for that patient. Those are the things that are fun. And when you get to do in the OR, it's kind of the culmination of that.
No, that's great. I mean, I think that's a culmination of your training, right? A culmination of all the things that you've learned from all those wonderful people in your Mount Rushmore that you mentioned earlier. Yeah. But then now, as it advances, as an innovation advances through relationships with industry, through those peer-reviewed studies that you've done, it's just every patient you have, I would say, the lens of perspective of everything, and
sure.
And you're constantly learning. What an awesome place to work, right? I mean, it's a gift, man. Okay. Here's another one that we touched on a little bit, but let's shift to some bold predictions. All right. So you're a rising expert in this field, in technology and spine surgery, minimally invasive techniques. What is spine surgery in 10 years from now? Or let's just put up 2030. So what
Yeah,
are we doing?
2030. So, it's a crazy thing. That's like, we're closer to 2030 than we are away from like 2010. So those things, we feel like that was just the other day, but 2030 is right around the corner.
Right.
So like 7 years from now, since I've, in the last year and a half here in Dallas, there's been two more major hospital systems buying robots in just this kind of small market area. I think it's gonna be like anything. If you bought a TV a couple of years ago, that price has already plummeted in terms of getting more affordable. Robotic technology, it's one of the things I'm passionate about. I think it's a very good technique. There's a great paper by Qureshi in the International Journal of Spine Surgery. They kind of compare the robotic technology to the Industrial Revolution. I think it's one of the better, more interesting papers, kind of just talking about the reproducibility of the whole thing. People, rightfully say, oh, the robot's slowing down. I'm so good without it. Okay, that's great. Good for you. I'm proud of you. But in terms of residency education, in terms of reproducibility, in terms of minimizing errors, that's where the robotic technology is going to be there. And like, yes, it just helps pedicle screws now. But I mean, how many tubular decompression cases have this audience done? And, one of the hardest parts I did to them today, like the most annoying part of the case, somebody's like a UR6 suture and like close the fascial layer deep. If you had a robot that could come in there and just, kind of do that for you, one, probably the insurance company would pay me less, but two, like how much easier would that be for just spine surgeons and just more reproducibility and consistency? So I think that's kind of a major area of things that in the next 7 years, the prices on robots going down, technology improving on those. I think there'll be more emphasis on expandable technologies. Indirect decompression was a huge, it wasn't as accepted a decade ago, but now it's, becoming more of the mainstay treatment. People used to say, oh, it's lazy because you're not decompressing centrally in the back. It's like, well, not really, man. Like if you're opening up those neural foramen from doing a cage, it's less morbid for the patient. That's all they need. So expandable technologies, that's where I think a lot of the future is going to. Very generic for me to say minimally invasive, kind of how's that defined? Endoscopic, it's definitely having a role. I think there's becoming more leaders in the field for that. Kind of minimizing soft tissue disruption will be kind of the key.
No, it's good. I mean, I think the trends are there, but I want to push back on something because you mentioned it briefly with the insurance company paying you less for things that could be done robotically and maybe a little bit easier. Do you feel that as technology advances, that your leverage lessens? Does that make sense? So
yeah, not yet. It's one of those things. It's if you could fly a plane on autopilot, should we pay pilots less? I don't know. Maybe that trend has happened. I'm not exactly sure, but like not really. Just because like the robot helps you with some part of the case, they're not nearly there yet. If I get to the point where a robot's doing the surgery for me, like hopefully I'm well retired and dead by then.
Yeah, right.
There's light years to go before we get to that, and it's not a crazy concept. I mean, any of the movies from the future, you have the person goes into some bay and like closes, like in Prometheus, closes down them and repairs them up. Like, yeah, do I think at some point in the world's lifetime we'll get to that? For sure, but I don't think we'll get to that at some point. But nor do I think the insurance company should pay the doctors or the medical groups, is the better way to look at it, less because we're getting more efficient. That's just not the answer. We should be rewarded for the efficiency.
Yeah, no, I completely agree with that. No, that's a good perspective. It's interesting. And, I definitely think that this is such a critical time because there's a wide gap between surgeries that are still done open. Like forget about robotic assisted or enabled, with using enabling technology, or not even close to minimally invasive. I think the large majority of procedures are still done traditionally, right? Where you're stripping the muscle off the back. And
yeah, I agree with that. And then, and that's, probably the majority of my cases. Probably the majority of my cases are still open. And I don't think there's anything wrong with that. It just depends on the pathology you see. I guess it's also, being younger in the field, the majority of my patients are Medicare as a broad generalization. If you're Medicare, you're over 65. Another broad generalization, if you have that, you have more degenerative disease, and some of the minimally invasive stuff can't knock that out. And so you need open cases for certain of those pathologies. So it just varies.
But I think I'm glad you said that because I completely agree. It's not a knock on open procedures. It's just a statement of where things are. But I think you have to have an appreciation for that, but also for open techniques, right? In order to, and this debate happened on LinkedIn recently. That's another great thing about surgeons posting, some of these things that brings out the discussion, because then to appreciate the ability to place a freehand pedicle screw, or if you have the ability to place that freehand pedicle screw like you do, then you can appreciate what navigation or a robotic assisted technology can do for you in your hands.
Sure.
And it makes you better, right? Or improves the precision.
Yeah, I agree. I mean, there's without question, you got to be good at freehand, because the overall majority of cases that everyone's going to do is going to be freehand. If we got to a point one day where if the robot cost, $80,000 and you can just wheel it in and it just kind of helps you navigate it through, the accuracy for the current ones are higher than freehand. There's many studies, many meta-analysis that show that robot's more accurate. But that doesn't mean everyone should be doing robotic surgery every time. Like
right.
The majority of cases I do are freehand, not robotic. I appreciate the value in the robot, but I agree it's a little slower compared to when I do it open.
Mm-hmm.
There's only certain hospitals have it. You need the staff. There's so many more things in the OR. I mean, all these things there. So do I think robots of the future? Yes. Does that mean I'm doing every single one of my cases robot? Absolutely not.
Right. No, gosh, it's just such a fun time to be in the space and to see kind of things change as they're and again, to have social media to catalog or tell that story as you go, which is great. And we'll look back on these times, hopefully, and we'll learn from them. Yeah. Well, so you mentioned industry a few times. I'd like that maybe, if you're still good on time, close out with this kind of last part of the discussion. And thank you again for being part of this.
Yeah, for sure.
Let's talk about your surgical team. So how have you built that? Maybe in the OR, do you have like a Donnally spine team that you like, certain scrub techs and nurses? And then also let's talk about reps. Let's talk about, what's important to you from a guy like me or a guy like I used to be.
Okay. So the scrub tech is probably the most important person. Now,
Agreed.
That said, and it changes all the time, even a hospital. So for me, I'm in a private practice group. We don't, if you're at a big active place, you're going to the same place, you probably get the same team every time. Me, I go to about 4 different hospitals, which is a little bit of a beatdown. I probably should cut out one of those, but we were talking about this before. Like when you have multiple hospitals you go to, they cater to you. They give you the things that you need. Right. They give you the things they like because they want you to bring cases there. And they use different hospitals for different things. Now that said, I get fairly amount of different teams. A lot more consistent now, but it's nice kind of when they know what I'm going to be wanting. And it's not even nice. It's your study showing it's safer for the patient. It's more efficient. There's less mistakes. There's more checks and balances. They know you want bank powder or something like that, or they know you want to drain, or that you need to drain. Just things like that. Just kind of increase the efficiency. So I don't have a set team yet. There's at each place I have 2 favorite people, and I'll openly say like, "Oh, you're my favorite. Where were you last week?" They're like, "Oh, they didn't put me in the room." And I'm like, well, "What the heck's up with that?"
Yeah.
In terms of reps, I'm probably not the most. I'm either the most popular or the least popular person in Dallas, because I probably use about 12 different rep teams now here between distributors and reps. Distributor was like a 4-letter word kind of going through training. I never even knew what a distributor was. I just of Stryker, of Zimmer, of Medtronic, Globus, and kind of outside that, DePuy, obviously. Outside that, you didn't really know what a distributor was. It didn't really make sense. Now here, you're kind of on the other side of it. See, there's advantages, because it's like maybe if I like the cage from this group, but they don't carry, or another group doesn't carry expandable cages. And, I say a pedicle screw is a pedicle screw. There's not too much difference in pedicle screws, but there is a lot of difference in the delivery system of screws. There's a lot of difference in some of the deformity correction, and in terms of if you're doing like a lateral or an O-lift, totally different ways in terms of getting down there. So that's where it's been helpful for me. The reps are the huge part of it. It's a screw is a screw. They're all the same, but if you have a rep that, 1 is your friend, 2 that you kind of you enjoy spending time with, you can kind of hang out with in the orgs. These cases could be 4 or 5 hours, but the 2 is knowledgeable, and you're like, especially when you're starting out. I sometimes say, I don't know, what do the cool doctors do in this situation? Or they say, what kind of graft do you want? I'm like, I don't know. What kind of graft does one of my partners, Dr. Park, use for this situation? They're like, oh, he uses these cancellous or cortical fibers. And having that is a big part of it. And the industry is a key thing too. Again, another 4-letter word, because they're a for-profit thing, they must be bad. It's kind of the health insurance or the hospital administrators think. That's just not true. You guys are trying to create products with physician help at times that's going to make it better for the patient. It's not like anyone's creating, every now and then, maybe like Coflex or something like that. I know there's now an assassin out for me who create things that just weren't as good, but we thought they were good at first, to be fair. It's not like anyone's maliciously
the idea was good.
Something. Yeah. And so that's the whole thing. It's we all need each other. And if hospitals want to get things to be cheaper cost, then at times we have to use more expensive implants at first, or more, newer technologies at first. And then once we kind of can figure out how to replicate those more efficiently and effectively, and that's when prices can come down on some of those things. So industry is a key part. I think, having expandable cages, having certain 3D printed technologies that, 3D printed technology wasn't even around. I might be wrong, about 10 years ago, like there was like not even fully, now everything's 3D printed. And I'm sure at the time hospitals were like, oh, we don't want to pay for that 3D printed cage. We don't care if it fuses better. That's not really our problem. Like we want the patient to come back. It's more money for this hospital system. That's just not how it should be.
No. And amen for you for standing up and saying that. I mean, the whole residual argument is a joke, and the people that bank on that, it's just, okay, how do you sleep at night? And I think, look, for us, for industry, just to make a statement, I cut my teeth. I spent 7 years at NuVasive under tutelage of Pat Miles, and he always had he's leading Alpha Tech now, but he always had a great statement that just really kind of resonated. It said, look, good surgery is good business. If you focus on, being there for the surgeons and providing good products and good service and making sure the surgery goes well, then we'll be fine, right? Well, everyone deserves to make a fair profit. It's not about that. It's more about just helping you and other surgeons like you accomplish your surgical goals. And that's it. And as a rep, definitely. That's what I focus on.
Yeah, I agree.
So, in terms of that, just like this has been such an interesting conversation because we've talked about a lot of variables of spine surgery, from the industry to the annoyances to the social media aspect and kind of that. And then obviously your legacy. What is there anything else? I always want to kind of close out with maybe like a question or anything you wanted to share or promote, right? This is a great opportunity for me to get to know you a little better, but also I want to give you the floor as well to share something. And so, I wanted to pass the mic to you.
Yeah, I guess, if any patients are watching, go to my website, make an appointment. But otherwise, on like a more serious note, I like talking about this stuff. It's kind of my niche. It's where I feel like I know what I'm talking about finally. And this is something where I'm passionate about. In terms of mentoring people, like everyone's had mentors in their life. For me, man, I had a mentor when I wanted to go to med school. I had someone who was helping me out. When I wanted to go to residency, I had people help me out. When I wanted to go into orthopedics, I had people help me out. When I wanted to go into spine, people help me out. So that's kind of what I've been doing on some of these Zoom talks. I don't have to go fly somewhere to give a grand rounds to USC, for instance. I can do a Zoom with Columbia and get to talk to them. And I can tell them kind of what my pearls are for your first couple of years out, what my pearls are for, we all grew up with social media. And so we're using it all the time anyway. Might as well use it to benefit your career. So that's something that I like to promote. That's something I'm giving a talk to a Florida program on next week. It's, we're doing it at night. Nice. There's 3 different programs where we can kind of talk about it. It said no attendings are allowed. And I'll just kind of tell them the nitty gritty. And then I even pull my phone back, here are the apps you should get. If you want to do this, this will save you time. This is how you do it. This is how you get efficient at it. So that's kind of my niche. The more people that are doing exactly what I'm doing on social media, the better it is for me, right? It's like, that's right. It helps. It's just a self-fulfilling prophecy. And so, that's kind of the only thing I'd be promoting now, except for if you have a family member in pain, then send them my way type of deal.
Yeah, no, I think it's great. And I love that you're out there promoting, this to other young surgeons or to any surgeon that wants to learn. What would be the website to send the people to find more about you or to book an appointment?
DonnallySpine.com is my website. And then, on any of the social media platforms, someone could just, message me, and if they want to get a time or early morning before cases or office hours or afternoon, I can talk to their program. And, there's even been people who are, applying like, hey, I'm a 4th year resident. I'm trying to get into Rothman or, one of the top programs. Can I just pick your brain one day on like things I should do or research projects, or how you got so many research projects in like a residency program that's not a research heavy program? Like, what are your tricks? And I usually just like, I'll just call you on my way home one day. We'll play phone tag. If you're busy, no big deal. If you call me back, I don't get you, no big deal. I jokingly say I always pick up my phone. That's another Alex Ficcaroism. He once chastised Greg Schroeder when Schroeder didn't pick up his phone. He's like, oh, well, you'll just never be chairman one day. It's no big deal, which is like the rudest thing to say. But now me and my buddy's like, man, I could call my buddy during his kid's like baptism and he would answer his phone and he'd be like, yeah, I can't talk right now. But like, that's one of the things. I always answer my phone. That's a big deal. If someone's going to take, everyone texts people these days. So if someone's going to take the time to call me, like, man, I'm going to answer my phone. It's not like you want to call me. It's like, you'd rather text me. Like, if you're calling me, let's talk.
Yeah. Or when I FaceTimed you right before you were about to go into the case. Like,
yeah, exactly. Yeah. Well, here you go.
Yeah. Hey, buddy. Well, so, okay, let's close it. Thank you so much. I'll put Donnally Spine in the show notes for anyone that wants to reach out, or they can certainly reach out to you on your social. I am going to throw a curveball. Final question. Prediction for SMU football under Rhett Lashley. New coach. Had a great year. It's tough to lose our coach, but
yeah, it's look, we have a path. We know what we need to do.
Yeah.
We got to get into a new conference. And I say we, I mean SMU football. Pac-12 or ACC is where we need to go. And that's it. What TCU did, they're a great example, is, they're in the Mountain West, right? And they won where they were at. That was a cruddy conference, but they kept winning. Then they go to a big bowl game every now and then, and they crush in those bowl games, and then they get invited to the Big 12. SMU is not getting the Big 12 because of Baylor and a little because of TCU. Whole different argument. Happy to talk about that all day also.
Right. Yeah.
So what we got to do is we got to get into the Pac-12. We got to win where we're at first. We got to get into a good bowl game. You got to win where we're at. You got to start the season. You got to be like Texas. You got to start the season ranked in the top 15 every year.
That's right.
Even without anything to back that up. How about that? How about that for a little Texas bashing?
Yeah, I love it, man. It's so good. It's good to be connected. It's great to be another Mustang in the wild. For sure. And
for sure.
Thank you so much for carving out some time for us on the show. It was wonderful.
Yeah, Jay, I appreciate it, man. Hey, man, whenever you do it again, I'm happy to hang out.
Yeah, we'll do that for sure. Honestly, thank you again, Dr. Donnally. Thank you all for tuning in to this episode of Sultans of Sales podcast every Tuesday. Tune in next week.
All right. Thanks, Jay. Thanks, everybody.
Thank you.